Good day. My name is Dr. Marlene Ravanera Sinadjan. I am an ophthalmologist from the Philippines, enrolled in Low Vision Rehabilitation Fellowship in the Indian Academy of Optometry from January to December 2022. Today, I am tasked to demonstrate to you preclinical evaluation of a low vision patient, and I will try to assess her needs. We'll make use of a low vision evaluation form and will show you how I'm going to help her basing on her needs, including dispensing low vision devices. So let us now call our low vision patient. We need to observe the patient from the time she enters the room, observe how she walks, is she with accompanying or is she alone, observe her gait, observe how fast she walks and settles down on her chair. Also, try to observe for eccentric viewing. Observe her all throughout the interview and observe her ways and assess her psychological status. Observe if she is in denial, if she is angry or depressed, or if she is already in acceptance stage. We start asking first with her history. What was the cause of her low vision? Who referred her? How long has she been suffering from low vision? And while doing this, try to develop a good rapport with the patient. If patient is already in her acceptance stage, and we need to ask what else does she want to accomplish using her remaining vision? What are her daily routine? What are her hobbies? Does she like to go to the malls or the park? Or how much of a reader is she? Does she like writing letters? Those things. So I will now start interviewing her. Good morning, ma'am. My name is Dr. Sinadjan. And your name is?
I'm Emilita Revilla.
And Emilita, how old are you?
I'm 62 years old now.
So how are you now?
I'm okay.
So you were referred to me by Dr. Evangelista, and she's given me a little bit of your background. She said you're a case of age-related macular degeneration. Is that right?
Yes, ma'am.
How long have you been diagnosed?
It's been 2 years.
And how has it been now?
It's tough.
Oh, I'm sorry. So you have come to get some help from us. What else do you want to do with your remaining vision?
I just want to help me to with my normal vision.
From the interview, patient is Emilita Revilla, and she's 63 years old, suffering from low vision due to age-related macular degeneration. She finds life to be tough after she had a problem with her vision. Her vision is said to be stable after she had a laser treatment and is currently under RX2 medications. She regularly goes to an ophthalmology clinic for follow-up checkup. From the history, she started to have blurring of vision 3 years ago and has been under the care of a retina specialist. She had a laser treatment once and her vision is stable since. She came alone, coming to clinic, riding a taxi. At home, she is assisted by her house help to do her household chores, like cleaning up, cooking, and doing the laundry. With regards to her goals and in her visual needs, she wants to be able to use her gadgets or cell phones to watch movies or shows and be able to be updated about her friends that she follows on Facebook. She is just a mild reader. She doesn't bother herself with reading the newspaper or any magazines. She likes going to the malls and do some window shopping, and she needs an extra help looking at the prices. Patient seems to be at the acceptance stage and is willing to do everything in order to better the quality of her remaining life. With that, we will now examine the patient. Okay, ma'am, we're now going to examine you. Can you please sit over here? And we will examine your distance acuity. So I'm going to give you this occluder so that we will examine your right eye first. And so, H, V, Z, D, S. How about this line? N, C, V, K, D. And how about this line? C, Z, S, H, N. How about this line? I can see, Doc. Okay, so we shift it to the left, to the right, please, and so that your left will read. Can you read this? I can't. Oh, okay. So what about this? Can you please cover your right eye? Can you please read this? 2. Okay, how about this? 4. Okay. So after examining the vision of her distance vision, I am now going to examine her near vision. Okay. I will also like to read to see if examine separately the eye. So first the right eye. Can you read this?
Yes.
Can you read this?
Yes.
Can you read this?
No.
Okay. So what about your left eye? Can you read this?
No.
Okay. Thank you. So after examining the visual acuity, we will now refract the patient. We can actually use the autorefractor, or we can also use, or we must do retinoscopy. Okay? Okay, we will examine the right eye and then the left eye. So after that, we will do retinoscopy. Ma'am, can you please again sit here? This is the retinoscope, and we should examine the patient by turning off the lights. Okay, tell the patient to look over there, and then with this distance, I think the working distance is about 1 meter, and we'll see if the light is going with movement or against movement. If it's with movement, then we'll use plus lenses. So we keep on going to the next lens, until we get we are able to neutralize it. And then once it is already neutralized, then we will record our results or findings. We will now examine the patient's, can you please turn on the light? We will now examine the patient's functional test. Functional tests will include the contrast sensitivity, the color vision, the Amsler grid, and also the confrontation test. So we'll start with a contrast sensitivity test. So until what line is it clear, ma'am? Is this clear?
No.
Okay. All right. So after the contrast sensitivity test, we will do the Amsler grid test. So we will see. Ma'am, can you see clearly all the squares?
Yes.
All the squares, ma'am?
No.
Okay, so which part is not clear? Is there any spot? Where?
Center.
Okay, thank you, ma'am. Then we'll do the color vision test. Okay? Can you
Yeah.
read it? Okay.
8,
Okay.
6,
Okay.
89.
I think she doesn't have any problem with the color vision. Now I'm going to demonstrate how to do confrontation test. So can you please cover your left eye with your hand and try, and me too, and then try to see if you can see my finger.
No.
Yeah? And then here.
Yes.
Okay. Alright. So that is confrontation test. So after that, we will all record our findings in our low vision evaluation form. So we have jotted down all the results of the patient in this low vision form. So we will now read the results of the patient. So her distance acuity OD is 1 plus 1 combined with minus 2.250 at 170 degrees with vision of 638. OS is 150 combined with minus 2 at 5 degrees with vision of 6240. Her near acuity is OU 3M plus at 30 centimeter with current plus 3 adds. Refraction in trial frame is OD plus 0.75 combined with minus 2 at 170 degrees with visual acuity of 630 near plus 250 adds at 40 centimeters 3M plus. OS is plus 150 combined with minus 3 at 5 degrees with visual acuity of 6240. Near vision is too poor to consider. With the other tests, there is decreased contrast sensitivity. There is central scotoma at near on armsler grid testing. So my recommendations are reading spectacles OD plus 850 combined with minus 2 at 165 degrees. This is distance therapy with plus 750 for near with a vision at 630. This will be for reading large prints only and for general use only. Patient is also advised to use hand magnifier when going out window shopping using 8 diopters or 2 times magnification. With non-optical aids, we advise for lighting. Appropriate lighting is advised because of her decreased contrast sensitivity. We will teach patient how to position light correctly. We will also advise teach her in her electronic aids, and also in her gadgets. We will have to tell her how to enlarge or teach her how to enlarge or zoom in or zoom out in her cell phone. We will teach her how to adjust the lighting in her cell phone. And we will teach her how to increase the size of fonts when texting. That's all. Thank you.